Welcome to Dr Joe Unplugged. This podcast contains general information and is not in any way medical advice. In space, nobody can hear you scream was the promo line for the 1979 film Alien. The seventh version of the franchise is hitting the screens. In Australian government, nobody will ever hear you take responsibility. Certainly the public won't, and because nobody does. Right, where are we going with this? There's a shortage of intravenous fluids in Australia. Now, a lot of you might have either been in hospital for some reason or visited a person in hospital, and therefore you'll have seen intravenous fluid bags. Now, these bags obviously contain fluid, typically saline, a form of glucose called dextrose. There's another one called Hartmann's solution. And these are administered straight into the veins, typically if people are not able to take fluids by mouth, often post-surgery, also administered prior to surgery, and also in obstetrics if a woman is giving birth. It's a very, very basic component of hospital care. And it's also used by, for example, the Flying Doctor Service. Obviously, in country regions, even some general practices will administer some medications intravenously and need intravenous bags. I really want to emphasise this is not a rare commodity. This is an absolute bedrock of hospital care. In fact, in some instances, people are sent to emergency departments because they need rehydration, often in gastroenteritis and in children in particular. The issue is not that they've got a gastro bug, but that they're not able to bring in fluids. So it's the hydration that is the key. So how do you run out of something so critical? Well, nobody seems to know, and nobody's taking responsibility, which is probably the bigger problem. And the TGA, which is the regulator, says that there's a global shortage. But nobody seems to have told other countries that there's a global shortage. The New Zealand, and I'm going to quote here, the pharmaceuticals director for New Zealand's drug purchasing agency, Pharmac, and I'm quoting here from the Australian newspaper, said there were currently no issues with supply of IV fluids for New Zealand and stock is available at wholesalers. The US FDA records a shortage only of one particular size of bag. So if there's a shortage globally, how come it's not affecting America? And you've got to think that they have a greater need for intravenous fluids in Australia on a pure population basis. But it actually gets a little bit worse. Australia does have a manufacturing facility and it supplies New Zealand. Well, that's good. That's great. We should be able to supply our trans-Tasman colleagues and friends. But there's also such a thing as home supply. Now, the national regulators, the TGA, apparently doesn't have a role in procurement, which is fair enough. They're regulated, they're not a procurement agency. The regulator does not publish details of saline bag shortages because intravenous fluid supplies are not classified as a reportable medicine. Well, they're not a medicine. I mean, it depends how you want to define the concept of medicine. It's not a pharmaceutical agent. But the TGA statement, again I'm quoting from the Australian, contradicted that view. It said IV fluids were part of essential medical routine and critical care. I don't think you can have it both ways. Now, it also turns out, and really got to give enormous credit to Natasha Robinson, who's the health writer at The Australian, because I don't see that this is getting a lot of airplay on other media, and particularly the government-owned ABC doesn't seem to want to talk about this at all. If somebody's out there seen something, then look, again, I'm happy to stand corrected. It appears that this has been developing for some time. The alarm bell was allegedly first raised by Tasmanian Health 12 to 18 months ago. It's reached a point where doctors are being asked to effectively ration use of intravenous fluids. Some of the suggestions that have been put out, and I'll read a few here, include use the smallest amount of intravenous fluid appropriate, limit IV fluid administration in day surgery, minimise fasting in surgical patients to reduce the need for fluid replacement, give medicines by alternative methods, and reduce the use of vascular devices as the supply crisis deepens. Now, this suggests that there's not going to be a solution anytime soon. Let's pull it back to basics. As I said before, these fluids are not made from obscure materials. It's salt, water, and sugar inside plastic. Now, look, yes, there's critical manufacturing issues. It has to be done right. There's only certain facilities that are going to be able to do it and allowed to do it and have appropriate accreditation. But the raw materials, by definition, water, salt, sugar, plastic, are not in short supply. And why is it that every other country, including, we spoke before about New Zealand and the USA, apparently Europe and the UK also don't have the problem? It seems unique to Australia. So who is taking responsibility for this? I've seen no statement from the Health Minister, let alone a resignation. But, doesn't seem to happen these days. Now, this is a minister who has plenty of time to make it difficult for people to stop smoking, but doesn't seem to have the time to make sure that there are enough basic supplies. And I really want to underline the word basic supplies available for Australian hospitals. Now, it's obviously not him doing the ordering, let's be clear, but there is such a thing as the buck stops here. If you're at the top, then you have to take responsibility for what goes on underneath you. So the health department has either mucked it up, or various state health departments or various hospitals. But the public system, whilst it is to some degree fragmented, and yes, each hospital is independent, and yes, different states run their own systems, yes, but ultimately, if they're all running into the same problem, then, you're going to think they all talk to one another, and they might have put together some scheme when this was looming. Apparently, they've now formed a response team. Well, it sounds a little bit late in the day. So, what is the solution to all of this? Well, to be honest, I don't have a solution. That's not my job or task. I'm not in that space. However, the next question arises, what have we learned from the response to the thing a few years ago when there was issues with supplies? And I'm sure you all remember, albeit you probably don't want to remember, issues with shortages of a number of staples in supermarkets and rationing. That should have been a lesson in terms of inventory management and adequate foresight in terms of what is going to be needed down the track, probably for any materials and any products, but especially for essentials. If we run out of caviar, look, it's, some people might not be happy, but, the world will actually keep turning. When we're talking about essentials, though, in a first world country, an essential for basic hospital care, and it's running out, and some hospitals are allegedly down to 24 hours supply, and nobody is taking responsibility, then that is an issue, because when nobody is taking responsibility, it means nobody's actually in charge. And worse still, there's a very significant likelihood that it'll happen again because nobody's running the show. All right, look, ultimately, in due course, this will probably sort itself out. Somehow they'll put in orders, they'll source from, perhaps we'll ask New Zealand if they can lend us a little bit back. Maybe we'll approach the USA. I don't know what they're going to do. But I think what we do need to do is have accountability at a ministerial and departmental level, and we need to have better planning so that we don't run out of a very basic hospital supply when every other country on the planet seems to be managing just fine. Thanks for listening to Dr. Joe Unplugged. If you enjoyed this podcast, please subscribe, like, and share. You can also follow it on all the socials. There'll be new content uploaded each week.